shoulder flexion with elbow extension. Gravitational pull, which is also being pulled downwards, which is being caused around the elbow and the shoulder to relax the muscles. Hi, I'm Dr. Tahmina, your physio fitness and rehab expert. Today we are going to talk about elbow dislocation. Elbow joint is a very important joint of our body. As we all know, all the bending and the straightening happens from the elbow. We get the strength from the elbow in lifting up things. So it's very important to keep the ligaments and the muscles strong around the elbow. If there's any kind of injury, suppose if there's a fall on an outstretched hand like this, might result in the dislocation of the elbow. Movement of the bones above and below in a particular joint. The humerus in the upper arm, that gets dislocated, moved away from the radius and the ulna of the elbow joint, which forms the bones of the forearm. Then there'll be a lot of swelling, there'll be redness, there'll be pain. So let's see, if we have a elbow dislocation, what kind of exercises should be done for the elbow dislocation. First, we'll have to do the elbow extension, support the elbow joint also. The trunk should be straight towards the wall. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Holding it here almost say 10 seconds and repeat it 10 times. After this, elbow flexion. Bending the elbow like this, hand should be moving towards the shoulder. Hold it for 10 seconds and then again relax. Next one would be, we'll have to move it sideways. The shoulder should be moving sideways in abduction. The elbow is not straight because of the flexion contracture which happened being in the cast. The pressure would be downward, elbow upward, and the forearm would be pushed downward to straighten the elbow. Okay. And the last one in this would be shoulder flexion with elbow extension, and pain-free as well as per the tolerance of the patient. Relax. Movement can be done of elbow flexion and elbow extension by holding it with the other hand, supporting the elbow and trying to do the self-strengthening exercise as a home regime. Whereas the elbow has to be supported and to be done as per the tolerance. Being held, and we are going overhead to almost 180 degree at the shoulder level. Try to relax the muscles of the arm, the forearm by doing these oscillatory movement. Gravitational pull, which is also being pulled downwards, which is being caused around the elbow and the shoulder to relax the muscles. Doing it with half-liter bottle and move it overhead. We need to strengthen the muscles around the elbow as well as shoulder also. These kind of exercises. Relax. 90 degree, it has to rotate and come down. Okay. अब छोड़ दीजिए इसको. Tear of the medial collateral ligament near the wrist, around the elbow. Putting IFT around the elbow joint. Try to reduce the pain as well as the swelling. Blood circulation, and it will also help to reduce the pain. You can feel, no? These are the exercises should be done after a shoulder dislocation. If you are having any kind of dislocation around the shoulder or there's a ligament tear, always consult a qualified physical therapist to do the exercises, because some of the exercises initially need the help of the physical therapist. Increase the tensile strength of the ligament and regain to your normalcy, your day-to-day life, which is very important. Thank you.